My name is Roy Douglas Otieno. I'm the coordinator of Meta Kenya CSOs Alliance for SRH. We are working within Lake region, and our focus right now is based in Kisumu County. We started this network when we went to attended a training organized by Access to Medicine in Nairobi in 2019, and this training was focusing on advocacy on SRHR. And this gave us a lot of pertinent issues that we need to focus in Kisumu. We've seen a number of tremendous outcomes and achievements with this. One of the things that resulted into this is that there was advocacy challenges that we are facing within Kisumu, and we brought on board a number of organizations. If you come to Meta Kenya CSOs Alliance, you realize that we have very few organizations who are big organizations, but we have the local organizations, both youth-led, women-led, and community-based, including persons living with disabilities. These are the people that help us to do a lot of advocacy that has seen us achieving more. Meta Kenya has been supporting our activities through grants, and we've been doing a lot of activities and working with the county government, working with the county assembly in terms of resource allocation, in terms of policy development. Some of the policies that have been developed, including reproductive health policy and also health finance bill, which is right now we are hoping that it's going to be gazetted anytime soon, and it will work to ensure that all categories of health systems are ring-fenced. So these are the things that we've done. The CSOs Alliance partners have been implementing a number of activities within the rural and also in the suburb, the slums of the community, to ensure that the sexual reproductive health system are reaching communities. One issue that came out strongly is about teenage pregnancy, which is a key issue that we are targeting in. There's a lot of teenage pregnancy around, but the CSOs is doing a lot of education to ensure that that is reduced. And also the issue of STIs have been so much rampant within the rural, and we've reached a number of over 750 number of youth that we've reached that are now practicing, and they have turned to be advocates. I think we've participated in a number of capacity building events. Number one is just a general capacity building on advocacy. The system, how we need to approach the decision makers, the real decision makers. Previously, we were just doing advocacy on ensuring that we go to stakeholders events, then we do advocacy there. But we realized during that time that if you want to do advocacy, then you target a specific decision maker who sometimes who has power to sign. And we've seen this working. That is one training that we attended. We've also participated in one of the training called social accountability, to ensure that we track the budget allocation by the county. And I can say that one thing that we've done as a network is that we've contributed a lot ensuring that there's more resource allocation. For example, this year we are having over 60 million for SRHR, but last year it was 47 million. There's an increase, but that has happened because we were targeting a specific decision maker, which is chief officer within the county. And number two is that the money for primary health care and money for community strategy has been increased to 110, and last year it was around 80. And this tells you how we are working. Now, what we are focusing right now is we've divided ourselves into two. One team will focus on social accountability to ensure that we track the money which is now allocated, to ensure the chief officer always sign this money to release this money for work. And also we need to ensure that the stakeholders and the government normally account for this money, and that's why we normally conduct quarterly stakeholders planning and review meetings to ensure that as we plan, we also review what they have done versus the money allocated. I think if you're asking this year, then I will say that we've achieved little. But if you asked last year, then I will say we have achieved a lot. Why? This year, our activities have been affected by COVID-19. We were not able to do a lot of work. We stopped our activities by the end of February. So meaning that all the plans that we had were still there. So it is when we are coming up to do a number of activities. And I can say that the county government of Kisumu, both the executive and county assembly, are very friendly. We've seen a number of achievements that we've been doing with them. And even yesterday, when we have a stakeholders forum organized by Access to Medicine, there were a number of achievements that were mentioned in that meeting. And I can say categorically that number one thing that we've achieved is to ensure that we engage the county assembly to ensure that they allocate more resources for health, not only SRHR, but to other systems, and also development of the systems. The systems are very important because if we have money, but there's no system or procedures or no policy to guide them, then it cannot be. So we are seeing them very positive to even develop more and also have the strategy for every department. I see the Alliance as a body that brings number of local-based organizations, just from the grassroots, supporting them, strengthening their system, capacity build them to ensure that they keep government on board, they keep government on tour, but they work in equal partnership. There's no competition here. It is the role of the government. We are supporting them to do their work. We are not fighting them. So I see a vibrant community, a vibrant Kisumu County, even other counties that work with the government in an equal partnership and ensuring that there's equality health within the county. I think based on the research that we've been provided with Meta Kenya Access to Medicine, there are a number of gaps that we identified. Apart from that, there are a number of gaps that have been mentioned by our CSOs down there. One thing is that there's a high prevalence of pregnancy. And there's a lot. I think this is a policy issue, and the county government, especially county assembly, need to come with a policy that reduces this. And this policy need a cost strategy, so that this need to be an implementation. You know, we cannot implement at county level or at division level. We want to go at Nyumba Kumi, down there, at the grassroots, primary health care. So one challenge that is facing communities there is primary health care are not being implemented. We are implementing community strategy, yes, but in a wrong way. So one thing that we must ensure that we embrace public or community dialogue so that community can solve their own issues at the ground. Not that we send the community health workers, they collect data, then they bring data at the county. Then for what? They need to analyze those data at the grassroots. They have a community dialogue. Then at the end of the day, they come up with their own solution, especially on the gaps that they identify.